Okay.
Oh, I must call these people back. Hello, yes. Is this Bethany? Oh, sorry, wrong number. Hi, Bethany, is that you? Yes, I had a missed call from you. Do you want to come in this afternoon? Okay, perfect. I look forward to it. I'll see you then. Bye.
Hello.
Hello.
How are you doing?
Hello. Hi, my name's Claire and welcome to Cairns Travel Agency. How can I help you guys?
Hi, I'm Damien Valentine.
Oh, Damien.
Bethany Hamilton.
Hi, Bethany.
We're two students. We got offered jobs in two places here, well, in Katherine and in Barcelona. So we are kind of deciding on the things about Katherine. And can you tell us a little bit about the place?
Yeah, of course. So I'll just start by telling you just a little bit about the community itself. So Katherine's actually the fourth largest town in the Northern Territory. It's situated 320 kilometres southeast of Darwin on the banks of the Katherine River. It sits on the junction of the Stuart Highway linking the north and the south and the Victorian Highway to Western Australia. The Katherine region covers around about 7,421 square kilometres, providing services to communities from the Western Australian border all the way to the Gulf. Katherine has a geographical classification of an ASGC-RA4, and this considers the community remote Australia.
So I'm a bit of a history fanatic. Would you be able to tell us a bit about the history of Katherine?
Yeah, sure. So I'll give you a bit of a rundown on the history and a timeline. So prior to the arrival of the Europeans, the area around Katherine was the traditional land of the Jawuyan, Walpurid, Dagaman and Waddaman Aboriginal people. The Katherine River and the Katherine Gorge were popular meeting places. When John McDowell Stewart passed through the area in 1862, he named the Katherine River. In 1889, gold was discovered at Mount Todd, which is about 50 kilometres north of Katherine. During World War II, 2 military hospitals were established in the town. On the 22nd of March 1942, the Japanese bombed the town and 1 man was killed. In 1926, the town was officially gazetted. In 1967, the Kata Caves Nature Park was officially established. In 1988, Woolworths opened the main street. In 1998, the Ralph Tyndall became operational. By 2000, mining had ceased at Mount Todd. And in 2003, the Gun Railway line from South Australia was completed.
Could you tell us a bit about the population?
So the current total population of the township is 9,187, and that's based on the 2011 census data. However, the regional population, including smaller neighbouring communities, is about 18,600. 52.1% are male, and the remaining 47.9% are female. The median age is 33 years old, and 25.5% of the population identify as Indigenous. Katherine has a subtropical climate with a distinct wet and dry season. There's an average of about 25 to 35 degrees, with an occasional 40-degree day during November and December. This is normally accompanied by high humidity. Education is quite low in the community, with 36.8% of people 15 and older finishing Year 12, and only 51.5% reaching Year 10. Alcohol restrictions have been put in place in an effort to try and reduce alcohol-related harm and antisocial behaviour in Katherine. A number of alcohol supply reduction strategies have been introduced, including alcohol-free Katherine town boundaries, liquor permits to be issued for special occasions, and there is also a liquor supply plan which focuses on restriction and removal of products with high alcohol content. This all became effective on the 21st of January 2008.
What are the educational facilities in Katherine?
And where do people work?
So there are 4 primary schools in the region, 1 special needs school, 1 high school, 2 childcare facilities, a Charles Darwin University campus, and also an Australian apprenticeship service which provides regular apprenticeship pathways to people in Katherine. So also in Katherine, people predominantly work in administration, safety, health, education and agriculture. The average weekly income is about $1,500, which is $200 less than the average wage in the Northern Territory.
So how do we get to Katherine, and when we get there, what type of transport's available?
So to get from Cairns to Katherine, there's no direct flight. So you do need to take a flight from Cairns to Darwin and then Darwin to Katherine. It can be quite an expensive flight as well. Once you're there, there's a Bodhi bus service, and this provides transport to individual travellers, Territory health patients and corporate clients to and from Katherine, with most connection services each day. So it operates bi-weekly to Darwin. So there's also a Katherine taxi service when you're in the thing. There's a car hire place, and there's a school bus service that runs on the weekdays. 70% of the community do have their own cars and travel by that. 8% walk and 4% ride bikes. Alright, so now that your flights are all finalised to Katherine, I'll email you your itinerary and transfers, and I hope that you guys have a lovely time there.
Perfect. Thank you so much.
No worries. Lovely to meet you both. Enjoy your time.
Good afternoon, ladies and gentlemen, and welcome aboard Airbus 360 to Katherine. I'm your Chief Flight Attendant, Larry. We'll be departing very shortly to the lovely town of Katherine, so please sit back and enjoy the flight. If you have any questions, please feel free to ask our friendly cabin crew. Oh, how can I help you?
I just pressed the button because I was actually wondering, could you tell me a little bit about Catherine's health status?
Well, interestingly, the health of Katherine is similar to that of the Northern Territory. Over half of the people of the Northern Territory consider themselves to be in good health. They are reported to experience much lower levels of psychological stress compared to the national average. However, this may be due to the limited availability of data and research in this area. However, the prevalence of chronic disease in Katherine is high. Diabetes, cardiovascular disease, lung cancer and mental health are the biggest burdens of disease, which is likely attributable to the large at-risk population that are living there. Around 64.3% of people in the Northern Territory were overweight or obese, which was higher in Katherine. Compared to the rest of Australia, Katherine has higher rates of daily smokers and has issues with somewhat substance abuse.
Thank you.
No worries.
Oh, yeah. Excuse me.
Oh, yes. How can I help?
What are they doing to improve the health status in Katherine then?
Well, in Katherine, there is the Katherine Hospital, which has 60 beds. It provides non-specialty medical, diagnosis and treatment and maternity services to the community. There are also a number of Aboriginally controlled primary health care services, such as the Wurliangus Health Centre, the Sunrise Health and the Katherine West Health Board. These services provide primary healthcare services, emergency care, social services, aged care programs, physical activity programs, childcare, alcohol and other drugs programs to the community. There is also a large emphasis on health promotion, such as the Strong Bala program, which supports young men who are experiencing difficulties and are helping to tackle the burden of substance abuse. There are also a number of other health centres, such as the Nitjapuri Community Health Centre, Clinic 34, Mataranka Health Service, Skatanji JF Doctors, the Bullman Health Centre, Nujuka Health Centre, and the Kalkaradinji Health Clinic. Oh, and there is also a private medical centre, the Gorge Health Centre.
Okay.
Oh, are you okay?
Oh yes, thank you. I've just got a bit of hay fever. I was wondering, when I get off the plane, is there a pharmacy nearby, Katherine? Or?
Well, yes.
What about a dentist as well?
Yes. Okay, 1 second. So there are 2 pharmacies that supply medications and health advice in Katherine.
Fantastic.
This includes the Katherine Amcal Pharmacy and the Terrace Amcal Pharmacy. And dentists? Well, there is one private dentist called Karasi M Dental. However, there is also the Katherine Dental Clinic, which is a public community dental service. This is available to concession card holders and pensioners, and also if you're part of the federal government's cleft lip and palate scheme.
Okay.
Thank you.
No worries.
Thank you.
Cabin crew, prepare for landing.
Oh, hi. Sorry, I just had a quick question before we
Yes.
landed. I'm moving to Katherine because I'm retiring,
Okay.
and I was just wondering, in case anything happens, is there any aged care available in Katherine?
Well, there are 4 aged care facilities here in Katherine. So there's Anglicare, which is the most common one that everybody knows about. There's also the Kalano Aged Care, which provides residential care, respite care and palliative care. There is also the Katherine Aged Care Hostel, which provides residential and respite services. And finally, there is the Rocky Ridge Aged Care Facility, which provides residential care, palliative care, respite and secure dementia care, and transitional care. Katherine has all the basic services you require for retirement, honeymooning, or just a quick getaway.
I cannot believe you scared me like that. Oh my god. Oh, a snake! Snake!
That was a close one.
Thank goodness we got through that door. Jeez, let's get to where we're going. Unbelievable. What about where this door leads to. Let's check it out. Oh,
Hello.
hello. Sorry, are we
Hello.
intruding?
No, not at all.
Oh, okay. Who are you?
My name's Faye Miller and I'm actually the Mayor of Katherine.
Oh,
Yeah, how
Can
are
we
you
come
doing?
sit down and
Oh.
have a chat?
Yeah, sure, of course. I'm actually free right now.
Oh, perfect. Thank you. Busy mayor.
Yeah, so what were your names, sorry?
Damien Valentine.
and Bethany Hamilton.
So you're the two youngins coming from camp.
That's right. Yeah, we
Heard
just.
lots about you through the grapevine.
Oh, good.
What brings you to Katherine?
Oh well, we just.
We just got a contract,
That's
or
right.
offered a contract to be working as dentists here. We're just newly graduated, so we just
Wow.
came to check it out and see if it's a good fit for us.
Learn a little bit more about the town, the people, and the community, and.
That's wonderful. Well, when I first moved here back in 1989, I thought I was only going to be here for around 4 years, but I ended up growing to love this town, and now I'm the third generation of my family here. And I hope you two will feel the same about our lovely little community.
So what made you stay here then?
Well, I believe, and I still believe, that Katherine has great potential, and I strive to make Katherine a place where people want to live, where they want to raise their family, where they want to invest in business, or just come for an enjoyable holiday. And I believe that wherever you live, you must take on some responsibility for development and growth of that community in any way you can, whether it be a sporting association, a health community or committee, a community organisation or local government. And I've always strived to achieve that.
Okay.
So I was wondering, maybe in the future we were wanting to be more heavily involved within the community, specifically in the healthcare. Is there any key information, key people we could talk to, get involved with, stakeholders, and kind of explain a little bit about that?
Yeah, of course. So Katherine has been home to many famous Australian athletes, including James McManus, Liesl Jones and Cadell Evans.
Oh yeah. Okay.
But also Mick Dodson, who's an influential Indigenous Aboriginal barrister and academic, and Clyde Fenton, who was actually the Northern Territory's first flying doctor, but also the first flying doctor to be his own pilot. Other influential stakeholders in the community include Katherine West Health Board, who are a 17-member strong organisation. They're a board of directors essentially, which decide, the strategic direction for the providing preventive, clinical and emergency primary health care in the Northern Territory. You've also got Menzies School of Health Research, which are Australia's leading medical research institute dedicated to, improving the health and wellbeing of Indigenous Australians. Oh, of course, you can also always ask any of the 5 other elected council members that we have here. Yeah, of course.
So just before we start being able to make an impact in the community, could you tell us a bit more about the health needs of Katherine?
Yeah, of course. So there has certainly been a big focus on men's health and substance abuse in Katherine. But just recently, Katherine Hospital underwent major changes to meet the health needs of our Indigenous community.
Okay.
So Katherine unfortunately did have a previous history of being pretty bad for Indigenous health. It was actually known as one of the worst places for Indigenous people seeking appropriate healthcare, but I can now proudly say it is one of the best.
Oh, nice.
So the hospital changed its ways by, engaging with Indigenous patients by using interpreters, and that was one way to overcome the language barrier.
Okay.
And we also started to change doctors' attitudes to working in a, rural, remote settings. So looking into the future, we also hope to employ more Indigenous liaison officers, Aboriginal health workers and Aboriginal health units, as they have been identified, as key facilitators of appropriate healthcare for Indigenous patients, especially those from more remote areas. And unfortunately at the moment, Katherine Hospital does employ around 24 doctors. They're not obviously all there at once, but with no Indigenous doctors yet. So that's something we'd also love to strive towards. And in terms of any more needs of the community, I would suggest going down to the hospital to talk with some of the staff there and just find out, ways what they use to engage with the community.
Definitely.
Okay.
You two may also want to be aware of a few barriers to community engagement strategies here in Katherine. So people may feel that their input doesn't make a difference, or they have a lack of information or education regarding health issues of this community. And they can often be intimidated by engagement methods. Accessing community engagement meetings or events can also pose as a barrier for member participation.
So, how can these barriers be overcome?
Well, it is important to have information regarding Katherine's health issues well promoted throughout the town. This can be done by putting informative posters in the community, creating announcements on our local radio, which is 101.3 Katherine Community Radio Station, and also holding information sessions at town centres. In terms of accessing community engagement events, to ensure all community members are able to attend. Multiple meeting locations and times should be available.
Yeah.
And invite stakeholders and other respected community members to be involved in running the meetings so members of Katherine feel more comfortable participating.
Yeah.
Right, definitely, of course.
Furthermore, it is important to consider that some residents have to travel quite substantial distances to seek healthcare or to even attend any sort of community engagement meeting. So we want to ensure that all people in Katherine are able to travel, reliably and safely.
Definitely.
Currently, the Town Council is working to provide a safe, well-coordinated and efficient system for our residents travelling away from their communities, and this includes planning for the wet season.
Okay, definitely. Thank you. All right, well, thanks again. Thank you so much for everything you've done for us
Thank
today.
you. Miller.
Where again did you say to go for the community engagement?
Yeah, so Katherine Hospital, so
Oh,
it's about
right.
4 kilometres north, so just follow up the Katherine River.
Okay, perfect.
Anyway,
Thank you
have
so
a
much.
good day. See you later. Bye.
Bye. It's a beautiful hospital here, isn't it?
Yeah, why don't we check out these rooms?
Yeah, sure. Do you want to check out that room? I'll check out this one over here. Oh, am I interrupting? What's going on here?
Oh, don't worry about it. You're more than welcome to come and join us.
Oh, well, it's no, I don't want to be bothered. Like, it's okay. I got other.
Don't worry about it. We insist.
Are you? I
Come
don't.
in.
Man, if you're gonna, okay.
Yeah.
Okay. Yeah, twist my arm. I guess I'll see what's going on. Community engagement, right?
Hi, it's nice to meet you. My name is Charles Payne. I'm the Executive Director for the Medical Services of the Top End Health Service.
Okay, nice. I'm Damien Valentine. Bethany and I have a 5-year contract to work here in Katherine as dentists, and actually talked with the mayor, and she said to come down and come to the community hospital and just to have a chat and see how we can engage in the community.
Oh, okay. What a coincidence. We were actually just talking about community engagement plan and different ways we could go about that.
Oh, perfect. Can you tell me a little bit about how we could engage with Katherine?
Okay, sure. So there are generally 3 methods of community engagement. The first is informal. This tends to be a bit of a one-way communication, which makes it difficult to establish a relationship with the community. Because it's a very rigid method of communication, it's not possible to clarify meaning, ask questions, or discuss issues or anything that the community might have for us.
Oh, okay. Well, that's funny. The mayor did mention different strategies of communicating with the town, such as radio announcements or having community events or posters, having information displayed so that the community can get more involved.
Yeah, exactly. Things like informative posters and advertisements make it easy for us to spread information to a lot of people in a short time. Usually we would use informative techniques to let people know about the issue and then let them know how they can give their input, which then leads into the next method of engagement, which is consulting. Yeah, so consulting forms a two-way relationship between health providers and patients, which allows us to exchange different views and ideas regarding health services, policies, and, in your case, dental health.
Mm-hmm.
By having an open exchange between health professionals and the community, it improves trust, rapport, and respect in the community. One thing to be careful of, though, is that you should always present feedback to the community because over-consulted communities can often feel resentful and may get the idea that their input has no value.
I understand. The mayor also did mention something about having information sessions. Maybe we could, make some focus groups and or workshops at places like the town hall or local civic center. We could also hold an information session on oral health, just because something I'm a little bit more familiar with, in one of the local parks, and have a barbecue, and so an incentive for people to come and just get everyone engaging together.
That's a great idea. Yeah, those are both great examples of how to consult and engage with the community, Damien. Honest and transparent communication and education work best with this type of community engagement.
Okay.
Activities like community barbecues are also a good way to increase community participation rates, as sometimes community forums and focus groups are limited to those who are comfortable with speaking in public.
Right.
Yeah. And then, of course, there's also the issue of who can actually make it into the workshop.
Right. I see. So, what is the last community engagement method?
So the last method of community engagement is collaborating. Collaborating involves the main goal of healthcare, which is empowering the community and giving them autonomy to make their own decisions.
Right.
Collaboration techniques usually involve making members of the community active participants in shaping the health needs of their town by giving them responsibility and information to look after their own health. This can be achieved by talking to local interest groups such as Indigenous art centres, the men's and women's groups and church groups in the area, and local influencers such as the council. And it's a good idea to combine these groups to create a local oral work task force. As they're members of the community, they're trusted and confided in much more so than people who are from out of town. As they have a great understanding of how to engage with people and their needs, it's also a good idea that way. This collaborative effort would take time to show results, but can make the community feel like their voices are being heard. This can be achieved through round table type discussions with local stakeholders, such as dentists, hospital workers, the council, the mayor, Indigenous elders, things like that. And this can also result in faster change, as there's not as much like back and forth between different offices.
Definitely.
One thing to keep in mind for Katherine is that some of the population is spread out, and they don't necessarily reside in the actual township. So for these people, there are several ways that we can try and reach out, including paper electronic surveys.
Right.
Electronic surveys are difficult because not everyone has access to internet and things.
Of course.
So we also try and run hotlines or door-to-door style engagement.
Yeah, that sounds like a great idea. One thing I have noticed that there's a large number of Indigenous people within these residing areas outside of Katherine. I'm guessing there would be need to some sort of cultural liaison there?
You're right, Daniel. To ensure that we have a safe, culturally appropriate practice and to engage with all of the community, it's really important that we have a liaison between health services and the local Indigenous people. So in Katherine, we have 5 local Aboriginal communities, the Binjari, the Rockhall, the Miali Brumby, known as the Kwano, the Gayilkan Nguru, known as the Walpari, and the Jodet Luk, which are also known as the Gorge Camp people. And this makes it difficult to engage with a broad, multi-spectrum approach. We have to engage each tribe individually.
Right.
Luckily, we have several Indigenous nurses and translators here at the hospital,
Okay, good.
so they can act as liaisons between healthcare providers and the Indigenous community and their various elders for us.
Wow, thank you. It sounds like we've got everything kind of under control. And
Yeah.
I'm sure you 3 are super busy right now, so
Yes.
I should probably head off and I should go find Bethany. I'm sure she's, somewhere around this hospital, so I should probably go find her. But we'll definitely be looking forward to talking more and, engaging more in the community.
Good.
Very nice to meet you.
Nice to meet you.
See you later.
See you guys.